from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Well, we're back with our sponsor, Baptist Health, in this month's Keep On Amazing. Clinical dietitian Lauren Widmer and patient Glenda Rowe are here to share how losing weight can be the best gift that you can give yourself. Thank you both for being here.
Thank you.
Thanks for having us.
Yeah, so I know that this is kind of that time of year where we start thinking about weight loss. A lot of people making those New Year's resolutions, but really any time's a good time to get started on that.
Yeah, we accept people all day, or all year round, but especially during this time we see the influx of just ready to better yourself and your health.
Absolutely, and you were one of those people
Yes.
walking in the door. When did you start with that journey?
I actually started with Baptist Health around June of this year. I'd actually gone to a dietitian who was also within that hospital by choice of my doctor because I had extremely high A1C levels. And so they sent me there. I'd already been to a dietitian before, and as I'm sitting there speaking with her, she says, "What is it that you want from us? Do you want a personal chef or what?" And I said, "Well, while that would be good, no." I said, "But I did notice that Baptist weight loss program right down the hall as I was coming through the door. Can I go talk to them?" And that's what I did, and that's how I started my journey. And with that journey being said, it has been remarkable and phenomenal for especially my A1C, because I'd gone to the doctor about 3 months into the program and my A1C had gone down by half. So it's an incredible program.
And a lot of people, really, it's just taking that first step. It's just going in and really talking to someone and kind of figuring out where you've gone wrong and where you can start going right. What's the biggest things that you've learned?
Portion control is definitely really important. You can probably eat several things that are a little bit iffy as long as you're portioning, but they've also taught me self-control. They've also taught me how to believe in myself and to believe in what that I can do this. And they're very helpful when it comes to encouraging you, giving you guidance. It's amazing when you step on the scale and they can look at the scale and say, you had too much, you're bloating this week.
Right.
Or, whatever. They can, instead of just going, oh my gosh, I've just gained weight, or I'm not doing as much as I want to do in the losing process. Very extremely helpful for that, and the food products are really good too.
Well, let's talk a little bit about these food products.
Yes.
I know you've brought some along, and we see a lot of this in our grocery store aisle, but this seems to be some special stuff that you have.
Yes, they are increased proteins, and the portion control is really where we tie in these products as a tool to help the patients learn those processes of portion control. So we have some shakes, some bars, some prepackaged meals that you can eat on the go so you're not eating fast food. And then just every kind of little thing that you may crave, we can kind of have a food to try that.
And so what are some substitutes? Let's talk about that, because a lot of people are like, well, I'm really craving chocolate cake. And when you're craving some sugars and things like that, how can you sort of fill that void?
Do you have any?
There's a bar that they have that is incredible. When I eat that bar, I think I'm eating like a real candy bar, and it is delicious, and it's packed full of protein. They have all kind of options for you. They have cookies. They have things that whenever you're craving something sweet, you've got the option. And you can always grab a chocolate shake. Those are always really good to pick you up, especially in the end of the day, whenever you need that quick pick-me-up at 3 o'clock in the afternoon. They work great.
And they've made a lot of improvements with this food as well, because I know when these diet foods first started coming out, people were saying, oh, they're terrible, they're not very tasty, but they've really made a lot of improvements on these foods. Let's talk a little bit too, I know the portion control, you brought along some things as well to help with that. Have those helped you, just having the containers and putting things in containers?
I don't always use a container, but the packaged meals, they're portioned out for you. So all you have to do is add vegetables and things like that to it, and you have a complete meal. Even for breakfast, it's easy to grab one of those shakes and just drink that on the way to work, or sip on it while you're at work, and then you grab a bar whenever it's a snack. But pre-portioning And I always plan, so I always have something. I know that I'm going to have this for lunch and I'm going to have this for dinner, so then I can plan throughout my day, and it makes it a lot easier for that journey.
As we wrap up here, what is your advice to other people? They may be watching this morning, just finished all those holiday meals, maybe not feeling so good about themselves, but what's your advice and encouragement for people?
My advice is that if you want to get on the program, do. Some people are on the fence about that. Get off the fence. It's barbed wire. It's electric. It will actually brighten your day, and you will feel so much better, especially when you get to see Lauren and Natalie, because I look forward to seeing them every Thursday. And they make my journey so much easier. And I say that if you want to do it, believe in yourself, and you can do it. And it does make you feel so much better.
And you're not doing it alone. Baptist Health is there walking beside
Always.
you.
Yes.
All right. Well, thank you both for being here.
Thank you.
Definitely inspired, I know, a lot of people out there. There's the information, by the way, on your screen. If you want to get in contact with Baptist, just call their health line.